In light of the positive case detected in both Raglan and Hamilton, ministers have agreed today to move these areas into level 3 restrictions alongside Auckland from 11:59 p.m. this evening. I'll now share a bit more specificity around the areas that will be covered by level 3 restrictions. It will include Raglan, then coming from north down south to Kowhata, Huntly, Ngarawahia and Hamilton City, based on the Hamilton City boundary. These boundaries will be published online. Just a word about the surrounding boundary areas. In terms of management of the boundary, in this case, Auckland's boundary will remain in place as it stands. For these new Hamilton areas, there will be spot checks around these boundary areas, but it will not be the same as the hard boundary we've been operating for the Auckland outbreak. The reason for that is simply a practical one. The Hamilton area simply has too many feeder roads for us to successfully operate a hard boundary around the outskirts of the area. So we ask people please to maintain compliance, and there will be spot checks in place. For those who live and work across these areas, we ask that those who can work from home do work from home. We intend at this stage for these level 3 restrictions to apply for the next 5 days. This is the same approach we took when cases emerged in the upper Hauraki area. It gives us the opportunity to contact trace and widely test in the coming days to assess if the virus has spread widely. If you live in these areas or have visited these areas and are experiencing even mild symptoms, please do get a test. After 5 days of wide testing, contact tracing and wastewater testing, we will assess whether the restrictions need to remain in place. It is not a coincidence that those in our current outbreak have not been vaccinated. Those who have not had a vaccine in New Zealand are currently in the minority, but they are the vast majority of our cases. That is because the vaccine works, but it's also because the virus is literally finding unvaccinated people. Vaccination makes a difference. It keeps people safe, but it also gives us choices. And this is how stark those choices are. If we had a vaccination rate at 90% or above in either Hamilton or Raglan, it is highly unlikely that we would be here today announcing level 3 restrictions. Instead, we would be able to rely on other tools like contact tracing and much lower level public health measures. But while we are still vaccinating, we have fewer choices in how we react to cases. And so this is a message for the rest of New Zealand. We are doing everything that we can to keep cases confined to Auckland and managing them there. The people of Auckland are sacrificing a lot to do that too, but they are doing that to give everyone else time to be vaccinated. If, in the meantime, the virus moves beyond the Auckland boundary and the places it moves to have low vaccination rates, then today is an example of how we will need to respond. So please, get vaccinated today if you want to avoid level 3 in your community, and we can avoid it in the future. Now, I know some people are nervous about the vaccine and wanting to wait a bit longer to see what happens. I understand. It's natural to have questions, but I can assure you the vaccine is safe and the experience is friendly and supportive. There are nurses and healthcare professionals on site. You get looked after, and if you have questions, you can ask them while you're there with people who are knowledgeable and supportive. There are still 887,000 eligible New Zealanders who haven't been vaccinated. But on the flip side, 79% have had their first dose. We have a different approach to COVID within our sights and in our hands. So as we all look ahead and we think about summer and the plans that we are making, make the first step a vaccine. It is the thing that will make those summer plans possible. So on that note, in the Waikato, there are 1,500 bookings available today and 2,800 available tomorrow. In terms of walk-in vaccinations that are available right now, you can find those at Te Awa, the base. Rokua, Haora or Tainui is open until 3:15 today. Rahui, Pokeka and Huntly, the Community Vaccination Centre, is open for walk-ins until 3:30. Anglesea Pharmacy is open until 11 p.m. Sanders Pharmacy until 3 p.m. And there are approximately 80 pharmacies, GPs and vaccination centres, including mobile services across the Waikato. Also today, there will be a pop-up vaccination centre in Raglan at 2:30 p.m. today, and we'll make sure that we put details of that out for anyone locally. Before I finish today, a quick reminder that tomorrow we'll be talking more about our roadmap forward, in particular for Auckland. On Tuesday, we have another step up in our vaccine campaign, and you can expect that alongside each day our reporting on developments in Hamilton.
So today there are a total of 33 new community cases to report. 32 of these are Auckland-based and 1 case is in the Waikato. Now you will have seen, and the Prime Minister's just mentioned it, that actually we are reporting a second case in Waikato, but it's not included in today's figures because of the time it was reported. It will be in tomorrow's numbers. Now of today's cases in total, 15 are yet to be linked. 2 of those have a possible link, and 3 of those 15 are all actually one whānau that live in a single household. Interviews are underway, and we would fully expect that those will identify links and connections to the existing outbreak. And of yesterday's cases reported, just 4 remain unlinked at this point, with investigations ongoing. In the Auckland region, there are now 5 active subclusters. That is where there are new cases that are emerging over recent days, and our public health efforts are significantly focused on those. On to those 2 cases in the Waikato. One of these cases lives in Raglan, the other in Hamilton East, and they are known associates or contacts. However, at this stage, there's no obvious link between these 2 cases and the Auckland outbreak, and we would expect that both the interviews of the cases and the whole genome sequencing, which has been done with urgency, will help us elaborate what that link might be. The case in Raglan and their family has been moved to a quarantine facility in Auckland. That case, the Raglan-based one, was tested on the 1st of October, having become unwell, and their infectious period is deemed to be from the 27th of September. So a pop-up testing centre has been set up at Raglan in the Raglan Rugby Grounds car park on Cross Street, and anyone in Raglan with symptoms is urged to get a test today. And in Raglan, if you haven't yet been vaccinated, now is the right time to do so. There's been quite a big increase in vaccination in Raglan over the last week or 2, which is great to see. Vaccination is available today at the Raglan Area School from 2:30 p.m. Just turn up. The second Waikato case is, as I say, a known contact of the Raglan case and was tested yesterday evening after becoming unwell. This person was transferred safely overnight to Waikato Hospital when the symptoms worsened, and they are being treated for COVID-19 related symptoms. And there are no exposure events at the hospital because they were prepared and ready to receive this person. That second case's household contacts are currently self-isolating, and we are getting rapid testing done on them. So today in Hamilton, the testing centres at the Founders Theatres car park in Hamilton CBD will have additional capacity added, and there will be a pop-up centre at the Claudelands Event Centre that's being set up at the moment. Again, anyone in Hamilton with any symptoms whatsoever of COVID-19 are asked to please get tested and isolate till you receive your result. Just briefly then on hospitalisations, 26 people in hospital today, the majority in Auckland, and as I mentioned earlier, the 1 person in hospital in Hamilton at Waikato Base Hospital. And 3 of the total number of people in hospital are in ICU, all at Middlemore.